Mesothelioma UCLA. Since 1997, UCLA's Comprehensive Mesothelioma Program has been using lung-sparing surgery and innovative postoperative therapies that stress quality of life as well as survival. Patients benefit from UCLA's expertise in performing a meticulous procedure, pleurectomy and decortication, that removes all visible tumor from the chest while sparing normal structures, such as the lung, pericardium and diaphragm. The surgery is followed by precise radiation therapy to target remaining cancer cells and avoid injury to the preserved lung. Patients also benefit from a number of existing and investigational therapies to target the remaining microscopic disease and slow its regrowth. Recognizing that mesothelioma cannot be entirely eliminated from the body, our physicians treat it as they would any chronic condition. That means we use frequent, often daily, well-tolerated therapies to slow its growth rather than using concentrated treatments whose toxicities may be excessive. UCLA has pioneered the use of therapies such as immunotherapy and cryoablation, which have led to significant advances in the care of patients with this condition. Dr. Robert Cameron founded the program. Treatment of sarcomatoid mesothelioma. Patients with sarcomatoid mesothelioma benefit from UCLA's expertise in this rare disease. We have found that chemotherapy agents typically used to treat sarcomas in other areas of the body are more effective in these patients than are the typical mesothelioma chemotherapy agents. This chemotherapy, followed by surgery and radiation, has provided significant advantages for patients in this small group. All patients are treated by a multidisciplinary team. A dedicated nurse practitioner helps to coordinate care and is available to answer questions from patients and referring physicians. Research. UCLA Comprehensive Mesothelioma Program physicians collaborate with basic scientists at UCLA, West Los Angeles VA Medical Center, and the Pacific Meso Center at the Pacific Heart, Lung, and Blood Institute. Our services. Patients with all stages of mesothelioma are provided with expert surgical, radiation and medical oncology services. Surgical techniques include lung-sparing tumor surgery, pleurectomy and decortication or PD, lasers, bronchial, airway, and esophageal stents and video and computer-assisted robotic surgery. Radiation therapy techniques include stereotactic body radiation therapy, SBRT, intensity modulated radiation therapy, IMRT, and radiosurgery using the Novellus TX image-guided system. Chemotherapy, immunotherapy and targeted biologic agents are chosen based on extensive experience treating mesothelioma. What is mesothelioma? Mesothelioma is a tumor of the tissue that lines your lungs, called the pleura. Mesothelioma usually starts in the pleura of the lungs, but it can also start in the abdomen or other organs. Often, mesothelioma presents with fluid surrounding the lungs. Risk factors. Asbestos exposure. Symptoms. Trouble breathing. Cough. Pain under the rib cage. Pain, swelling, or lumps in the abdomen. Constipation. Weight loss for no known reason. Diagnosis and screenings. At times, it is hard to tell the difference between malignant mesothelioma and metastasis to the pleura. Imaging tests and biopsies are used to make the diagnosis. Treatments. Traditional treatment may include surgery, radiation, and chemotherapy. At UCLA, we have established a working group to manage recurrent mesothelioma with minimal invasive image-guided cryoablation. Using this technique, up to 90% of local recurrent tumors can be controlled with